Moving towards our second scientific session, the topic is addressing the unmet need in diabetes treatment paradigm with innovative combination injectable. As a speaker, we have Dr. Rishad Ahmed, attached to Manipal Hospital, famous endocrinologist, associate professor, KPC Medical College and Hospital. And to chair this particular topic, I would like to invite Dr. Sanjay Shah, the founder president of Howrah Diabetic Society, HOD Diabetes and Endocrinology, Narayana Super Specialty Hospital, Howrah, and Dr. Sandeep Paroi, associate professor, Department of General Medicine, JIMSH, Kolkata. I'd like to request both the chairperson to please take your seat and introduce our speaker. Thank you.
Good morning, all. So, I would like to introduce our next speaker, none other than Dr. Rishad Ahmed, an eminent medical teacher and consultant physician. He is a faculty from KPC Medical College and an eminent diabetologist. He'll now going to discuss on innovative combination of injectables in treatment of diabetes mellitus. Over to Dr. Ahmed.
Good morning, and thank you everyone. And at the onset, I would like to thank the organizers for having me today for this scientific meet. And without much delay, I'll be talking about the today's talk, which is addressing the unmet needs in diabetes treatment paradigm with innovative injectable combinations. Okay, so slides are visible. So what are the unmet needs with complex regimens in type 2 diabetes? So we know diabetes is complex, and the treating diabetes has become more complex with the advent of new drugs what we have. So multiple injections, reduced flexibility, and the risk of weight gain. These are the few things we normally face. And the factors impacting the potential treatment burden of complex treatment regimens are lifestyle modifications, multiple daily injectables, diet, and physical activity. So how do we address this unmet need? We have now combination injectables, 2 titrable drugs in one single pen. Igla-Lixi is a combination of insulin glargine U100 and lixisenatide, and is approved in India as well. What is the benefit of Igla-Lixi? The benefit of Igla-Lixi is, you can see on the left-hand side, insulin that takes care of the hepatic glucose overproduction, increases the glucose uptake at the level of the muscles, and decreases the lipolysis. And on the other hand, on the right-hand side, you can see the GLP-1 receptor agonists and its benefits. So, as Dr. Ralph DiFronzo mentioned ominous octet, it is taking care of 7 out of the 8 pathophysiological mechanisms of ominous octet. And along with this combination of Igla-Lixi, if you add a metformin and a SGLT2 inhibitor, then all the components of the ominous octet are being taken care of. Complementary modes of action of basal insulin glargine U100, that is Igla-Lixi. You can see the various effects. Effective HbA1c reduction, both fasting and postprandial sugars are being taken under consideration and control. Address multiple pathophysiological defects. More people achieving glycemic target of HbA1c of around 7. Once daily dosing, weight neutrality or weight benefits. Lower rates of hypoglycemia, and improved GI tolerability vis-a-vis the mono components. These are all the global guidelines which we generally follow. I'll just mention the recent ADA 2024 guidelines, which clearly tells us that the combination of the basal insulin and GLP-1 receptor agonist has potent glucose lowering actions and less weight gain. In fact, this is a weight neutral combination, and hypoglycemia compared with intensified insulin plans. So I have been using this molecule, and I know that the chances of hypoglycemia and the chances of weight gain both are very much reduced with this combination injectable. So what evidence do we have with Igla-Lixi? We have a huge wall of evidence now. The SOLI-D, the SOLI-MIX trial, and all the other phase 3 trials are put upon in this slide. Now, the questions being asked and the questions being answered. Igla-Lixi versus Ide-Gasp. So many of us had this question in mind initially, that if we compare Ide-Gasp with Igla-Lixi, what will happen? So here we have a study, SOLI-D, and which took into consideration Igla-Lixi once daily and Ide-Gasp once daily. And you can see that that the primary endpoint was non-inferiority in HbA1c changes from baseline to 24 weeks. These are the key secondary endpoints and the safety endpoints. And in the safety endpoints, we have the chances of hypoglycemia, ADA level 1, ADA level 2, and ADA level 3. This is the baseline demographics of this study, almost same in both the groups. And I'll directly go to the results. So, greater proportion of participants treated with Igla-Lixi reached a HbA1c of less than 7, HbA1c of less than 7 without any body weight gain, and HbA1c of less than 7 without body weight gain and no hypoglycemia. So, as compared to Ide-Gasp, we have all these benefits as I have already mentioned. Igla-Lixi also showed reduction in 7-point SMPG values, and as you can see the bottom line, the mean difference in 7-point SMPG between Igla-Lixi and Ide-Gasp was approximately minus 8 mg/cent. Lower mean total insulin dose, so the insulin dose requirement, although I don't think it is a clinically significant value, Igla-Lixi, it was 0.4 units per kg body weight, whereas in Rhizodeg arm, it was 0.48 units per kg body weight. Again, any hypoglycemia, ADA level 1 hypoglycemia, ADA level 2 hypoglycemia, and event rates of hypoglycemia, that is patient per year, everything was seen to be superior in terms of reduced hypoglycemic incidence with Igla-Lixi as compared to Ide-Gasp. This is from the SOLI-D study. So non-inferiority and statistical superiority in HbA1c was achieved, superior body weight benefit, more patients achieved the composite endpoints, lower rates of hypoglycemic events in Igla-Lixi arm, and no unexpected safety data. Again, the next question being asked from most of the physicians or most of the clinicians like us, Igla-Lixi versus Iglar versus Lixanatide in type 2 diabetes. So, how this will differentiate between all three groups. So, Lixilan-O study was done, and it took into consideration 3 groups of patients: Lixisenatide metformin in one arm, Igla-Lixi metformin in another arm, and Iglar and metformin in the third arm. So, Igla-Lixi complements Iglar and Lixisenatide effects to achieve a meaningful HbA1c reduction close to near normoglycemic effects without any increase in either hypoglycemia or weight gain compared to Iglar, and had low GI symptoms as compared to Lixisenatide monotherapy. Third question asked by clinicians was answered by another study, that is whether Igla-Lixi fared better than a dual twice daily bias 30 combination. So a SOLI-MIX study was done which compared Igla-Lixi once daily with bias 30 twice daily. And number of participants from India was 182 out of the total 887 participants in this study. So this again clearly shows subsequent hierarchical testing that HbA1c reductions were superior with Igla-Lixi vis-a-vis bias 30 twice daily. Composite target achievements was significantly greater with Igla-Lixi, and Igla-Lixi group required smaller mean daily insulin dose as compared to bias 30. So this is from the SOLI-MIX, and the levels of hypoglycemia were also not significant. Efficacy wise, Igla-Lixi versus bias 30, better glycemic control with weight benefit. So there is a weight gain, we all know. We have been using bias 30 for a long time, and we have seen how much weight gain it can cause. But when we compare it with Igla Lixi, even in our real world scenario, in our OPD practice, we have seen that it is a weight neutral combination. Lesser hypoglycemia, fewer injectables, fewer daily injections, and similar proportion of adverse events. Igla Lixi is an efficacious, simpler, and well-tolerated combination injectable alternative to premixed bias 30 twice daily. Regarding the pen and the technology, we all know Igla Lixi pen is a pen which contains glargine and lixisenatide in a ratio of 2:1, where glargine is 2 units with every 1 micrograms of lixisenatide. This is a 3 ml pre-filled syringe which contains 300 units of insulin glargine and 150 micrograms of lixisenatide, and the dose range is from 10 dose steps going up to 40 dose steps. And how to start this therapy? So there is a protocol which is given here very clearly. If the patients are insulin naive, then start with 10 dose steps. If the patient is on insulin glargine and requiring around 20 units, then you start with 10 dose steps. If the requirement of insulin glargine is more than 20, then you can start the patient directly with 20 dose steps. So this is regarding the starting or initiation of the drug. And regarding the titration of the therapy, as we do in with glargine U100, that is Lantus, weekly dose adjustments based on the fasting blood sugar levels from the last 3 days. Timing, what should be the timing of Igla Lixi? Igla Lixi should be injected subcutaneously once in a day within 1 hour prior to a meal. So preferably, it should be a dinner. But it can also be given before lunch. But we prefer to give it in a dinner because we have Lantus on the other arm. It is preferable that the prandial injection is performed before the same meal every single day when most convenient meal has been chosen. In case of missed dose, it should be injected within an hour prior to the next meal. Usage in the special population. So in elderly population, no dose modifications are required. In renal impaired patients, you can use this combination, injectable combination in all patients with eGFR of more than 30. Hepatic impairment, no dose adjustments required. Pregnancy, not to be used. So Igla Lixi, it's a 1 injection once daily, 1 hour prior to meal. So rule of 1 is the normal rule that we follow when we use Igla Lixi. Combination injectable Igla Lixi is a synergistic once daily combination injectable of basal insulin U100 and prandial GLP-1 receptor agonist lixisenatide that provides effective fasting, which is being taken care mostly by the Lantus arm, and the PP sugar, which is being taken care by the GLP-1 receptor agonist arm. That is lixisenatide in this combination injectable. SOLI-D trial, as I already discussed, indicates that Igla Lixi is a simple, well-tolerated treatment that has shown better glycemic control with added body weight benefit and lower risk of anytime hypoglycemia events as when compared to IDEC-ASP, that is Rhizodec. SOLIMIX trial indicates that the Igla Lixi is efficacious, simpler, well-tolerated, provided better glycemic control and weight benefit, and lesser hypoglycemia as compared to twice daily bias insulin. So thank you very much for your patient hearing, and thank you, chairpersons. If there are any questions.
Sure. So thank you very much, Rishad, for a nice presentation. So questions from the floor? Somnath, yeah.
Yeah,
can you check your mic, please? Yeah.
Okay, it was a nice presentation. The thing I want to know is that can it be given twice daily?
No, this is a once. I told you the rule of 1. So this is a once daily molecule because it has got 2 components. One is the Lantus part, that is glargine U100, which must be and should be given once in a day. And other part is the lixisenatide. So it is a once daily molecule.
That's true. But IDEC-ASP, we can use it twice daily.
Yes. As far as I am concerned, I don't use it, but in the PI information, it is clearly written once or twice in a day. I don't know why they have written, but they have written. I don't use it.
Can I say?
Yeah,
so
please.
I think the recommendation is once a day. So, but as you rightly pointed out, Somnath, that there are the odd patients whose once a day Lantus is not enough, and we have given them twice a day instead. Similarly, for this mix as well, you may perhaps, on the odd occasion, give it twice a day. Again, because it is a short-acting GLP-1 analog. But you have to remember that the maximum dose of lixisenatide is 40. Okay, so do not exceed that, because that we do not have the data, and there's no study to show that you can give it twice a day and what happens. But I think logically speaking, you perhaps can. Okay, that's how it is.
Okay, thank you.
Is there any special precaution for pancreatitis patient?
Yes, this is again a good question.
Just like
In
conventional
pancreatitis
GLP-1s.
patients, we cannot use it actually. We should be very careful.
Cannot use.
We cannot use, we should not
even
use it.
with dose reduction.
No, no.
Okay.
Not to be
Thank
used.
you.
And not to be used with gliptins. I have seen many prescriptions with gliptin and Igla Lixi. That is wrong again.
So one last question from my side. We talk so much about GLP-1 analogs and cardiovascular benefits, but I think from whatever little I know, lixisenatide as a GLP-1 analog has not shown, or a trial has not been done in terms of cardiovascular outcome. So how would you place it really? I mean, how do you place this combination of glargine and lixisenatide combination? Would you at all utter the word will protect your heart by any means, or how would you put it?
So there is always a class effect in all the molecules and all the groups. I think from the Sanofi part, we have only one combination injectable, that is this, Igla Lixi Soliqua. We don't have any other option as of now, and more studies have to be done regarding the CV safety. Even in terms of renal kidney outcomes, the albuminuria level is not brought down by this molecule.
I think they have done a CV safety study.
I am not aware of the
they've done a
results.
CV safety study, that is all. But
With lixisenatide, with
But-
this molecule.
This lixisenatide.
I don't know.
But obviously they've not done a cardiovascular outcome trial in that fashion. Okay. So you're quite right, as you rightly said. Is there an element of a class effect or not? Maybe more studies needs to be done from Sanofi to be able to say if it has any benefit. Anyway, thank you very much. Thank you. Big hand to him, please. Thank you.
Thank you, Speaker. Thank you, Chairperson. It's time to felicitate our speaker. Oh, sorry.
I think one last question.
So that is coincide with the glargine simultaneously.
I don't get your question.
What is the plasma half-life of the two ingredients?
Plasma half-life.
Glargine and that
Glad, glargine acts for 16 to 18 hours.
and
Lixisenatide is a very short-acting GLP-1 analog, only 6 to 8 hours, that's all.
okay.
That's why he was asking the question about twice daily.
So it acts as a mixture, just like mixture.
Yes.
Thank you, sir. Thank you, Speaker. Thank you, Chairperson. I would like to request our Founder President to please felicitate our another Chairperson and Speaker.